have to credit one of the vets in our clinic. Laura Bruner came back from a reproduction session in the last couple of years, and I was just asking her how, what she all learned from it, and we were talking about it, and one thing she said sort of hit home with me. She's like, well, how everything's better, and she kind of took it home from the conference. Everything's better. We're doing better. Like Amanda shown with the guilt development and all these things are all better. And then she said, and then semen quality, all the semen stuff's so much better. That's all better too, right? And I started thinking about it, and I was like, I wonder if that's really true. What are we really doing different today than 15 years ago, say? So I went back and looked through some procedure manuals from like 1996 that I had written for some of our clients, and then what are we doing today? What are we doing better? Then I found remembered that I'd given a talk, and I think Billy was in the same session. So we're both getting older, but in 1998 I gave a talk, quality control in the lab, and kind of showed just some things that were covered in that. It was a pre-conference session here. So one of the things that I went over was sanitation in the barn, in the lab, and I had a list of do's and don'ts. So that really haven't changed a whole lot there. Talked about lab processing, calibration of equipment, and in particular for concentration, and talked about how much that's where most of the air is typically in the labs. And then I had a chart where we showed like correlation with an IVOS or CASA machine. Talked about ejaculate assessment, motilities using pass-fail, based off some work Billy did long time ago. Talked about doing morphological assessment, counting 50 to 100 sperm per ejaculate, and using a cutoff, correcting for abnormalities, which is basically the same thing we're doing today. Acrosomal ridge evaluations. At that time we were doing every 2 weeks. Adjusting for sperm per dose. I had a bunch of data on 6,000 ejaculates where we had done acrosome evaluation and shown kind of the breakdown. So that's pretty similar. Then we talked about other tests, quantification of seminal plasma proteins. This was 1998. Fluorescent staining tests, CASA, osmotic resistant testing. Other things covered were agglutination, contamination, different processing parts of the lab, and then talked about pre-screening of boars for fertility, which is the topic of my discussion today. And at that time, all those different assessments, if the majority of their first 10 ejaculates fail, then we call a boar. So what's different today? Not much. Not really. Not really doing a whole lot different. I mean, it's kind of embarrassing putting the talk together, and Amanda alluded to it earlier. There has not really been a lot of funding for research where it should be. Some things are better. Amanda talked a little bit about the more accuracy in the sperm counts. I think throughout the industry, doing real-time monitoring through a reference lab. I think most boar studs participate in that. For most of the studs in our clinic, we monitor every production day. They send in a sample so we can make quick interventions. And this shows just the data through our lab. This is about 8 years, the last 8 years of data. But you can see our sperm counts basically stayed flat. But when you look at the standard deviation of samples through our lab, we hardly had any studs that were running under 500 million standard deviation back in 03, 04, and now most are running really tight on variation. This is another thing that's changed a lot, is growth of bacteria. Probably didn't monitor that real frequently. A lot of times in those days, maybe once a month or something like that. Now we've been doing it every production day through our practice, and I think looking at some of the other labs like Gary Althaus and Chris Custer, they've seen a similar trend. When we started, we averaged about 40 different studs in this data set. Averaged about 20, 25, 30% of the samples with bacterial growth would have been common back in 03. I think year to date through our lab we're at 2%. So that's a huge improvement over time. And then genetic information, not really something the boar studs have directly control over, but EBVs being updated regularly in the stud. I'm not aware of any studs other than maybe at a nucleus level that got EBVs in '98. So thanks a lot for the genetic companies for providing that. It's really it's the thing that the managers spend the most of their time on is managing the EBVs and which boars to collect and which boars to cull. And the modeling data, like what Amanda showed, has been really useful, and then producers understanding it. Back in '98, there was some boar studs that were buying natural boars and putting them in the stud for collections. So that's certainly changed. So where do we go from here? As mentioned previously and from George, we need to be able to get more sows bred from higher index boars. There's certainly a lot of value there. Amanda showed the numbers. We need to get lower sperm per dose, below 2.5 billion. But we need to do more, I would argue, to evaluate boars to maintain the fertility. So we've had a pretty good cushion in there, doing just the evaluation, monitoring the sperm counts, but really up till this point, all of the screening happens at the boar stud on the ejaculate as it comes in the lab. And we need more tools. Excuse me. Why haven't we reduced sperm numbers? This is some data that I published with Don Levis, where we had 2 large systems. We had 4 years of data, and what we did was the samples that came through our lab. That we feel we have a very strict and regimented process to analyze the sperm counts. In addition, we send samples out quarterly to 2 other labs. So we feel like there's good cross-referencing there with Gary Althaus' lab and Chris's lab. And so what we did was looked at 4 years of data, and then we retrospectively looked back at all the sows that had been bred by a single pool ID. And we knew the sperm count, we knew whether there was bacterial growth or not, and what did we get? Well, didn't look very good. The doses that were below 2.5 billion, we lost over a pig, total born in both systems, and kind of a leveling off in this 3 to 3.5 billion. Didn't have huge numbers out here, I guess, but had pretty big numbers in here, and that's kind of why we stayed. I think a lot of people have stayed in that 3 to 3.5 billion range. Was when they drop below that, you'd see the drop off. We have the Dutch model with the single sire matings, where everything's single sire matings all the time. They do have the seamless integration with the sow data, and so they have continuous and ongoing feedback. We don't have that, and that is a big disadvantage that we have. Not only are they able to pre-screen boars, but they did continuous feedback over the boar's lifetime. Single sire matings, as Amanda and George talked about, if you do, you need about 50 or more matings per boar as they enter the boar stud. You can look at conception rates at 30 days and then farrowing rate in total born. Advantage is that you have real data, and it's generally been considered kind of the gold standard for fertility evaluation up until this point. There are some challenges with single sire matings that I'm going to go through. It does add labor to do single sire matings. I guess what we've seen through this project and through Amanda's project and just past experience when we've done single matings, half to one person more in the stud to keep track of all the single sire ejaculates. There's also a lot more labor on the sow farm to do single sire matings. They got to look, make sure they use the same boar that they use on the first mating. There's almost a need to set a deadline. Often that may be one turn of isolation. Maybe this is something that'll be worked out as we move forward. But right now, one of the problems with single sire matings in doing it, and I'm coming to you, just presenting the good and the bad. I mean, I'm just telling you all. So one of the challenges we had with the single sire matings is some boar lines don't produce very well. When they enter the stud, 8 or 10 doses is pretty typical on certain purebred lines. So you got a lot of collections to get your 50 matings. There are boar replacement deadlines. Some of the genetic suppliers, if they're going to replace a boar for credit, you maybe have to turn it in within like 5 months or 3 months or so many days. Okay, so if you're at some point you gotta, okay, are we just going to eat the cost of this boar ourselves? And that may be the best financial way to do it to get enough data to make a good decision. But there is a tendency always to get the boar, for the producer to want to get the boar replaced if he's infertile. So that there's kind of a conundrum there. The early results don't always translate to long-term result. So just because the boar was fertile in his first 50 sows bred, it doesn't necessarily mean he's going to be fertile 2 years, a year later or whatever. It's a good start. It's something we can do, but I guess our data we didn't. There's just like Amanda showed. There's some boars that start good, go bad, start bad, go good. So you just need to be aware of that. And then there's a study was published in the JAVMA in 1989. Kirk Clark, Al Schenkel, Wayne Singleton, Einstein, and T. Claw. And what they did was looked at whether the farrowing rate of the first 10, 20, 30, 40, or 50 single sire services were predictive of subsequent services through 100. In that study, the maximal R-squared was only 11%. And then their conclusion was the farrowing rate of the initial services of boars less than 50 cannot be used as a reliable estimate of subsequent services through 100 farrowings, and therefore cannot be used as a management tool for culling subfertile boars to improve herd reproductive performance. So what we're using as a gold standard, someone published a paper saying it wasn't that great. And I talked about this already, but the young boars 8 to 10 ejaculates, it may take 30 to 36 weeks by the time you get all them sows farrowed and get the total information back, which is about halfway through the boar's life. So I think you roll all those things up, and there is a desire or a need to have some added tests. Is there some other things we can do to help improve this screening out these subfertile boars? CASA motility is something that's been looked at. In that they showed that with Hanneke Feitzma and that group that there was some predictivity with some of the motility parameters, more so by a trained lab technician. So there was some technician-dependent issues there. The Fourier harmonic analysis, Kilby, Willenberg, and Kevin Rosenboom of doing some work on that. And then flow cytometry. The SCSA test, Don Evenson at South Dakota State, and cell membrane viability, ubiquitin, a whole host of other tests that have been looked at in the research setting in small scale in the lab, but really we don't have them all rolled out to the field yet. Flow cytometry, sorting, staining the sperm for different characteristics, and then sorting it allows you to do huge numbers of sperm. So in the boar stud lab, we count like 50 to 100 sperm. Well, in the flow cytometry, you can do 3,000 sperm or something in seconds. So it's much more efficient and improves the accuracy. And this is the kind of different scatter distributions you get. this is the example of the SCSA test that Evenson has. Sperm viability and acrosome status. We can do acrosome evaluations on a fresh sample, but it's pretty time consuming. To do 50 sperm takes about 5 minutes to do under a microscope. So again, you can do 3,000 sperm or something in seconds if we're looking at the flow cytometry. Oops. And again, we get the scatter gating. The gating can be set to separate out the populations. Mira is another type of cell membrane viability test. So you roll this all up, and what we wanted to look at was what can we do today? What's available today to try to, in addition to single sire matings, what other tests can we put in today to improve the accuracy of that? The first step in that, it was a two-phase study, was to screen a population of boars with the various technologies today, including the single sire matings. And then in phase 2, I guess kind of along the lines of what Amanda presented, then can we take this to PCAI, and we wanted to evaluate PCAI compared to conventional AI. So the objective was to determine the effect of a complete post-cervical artificial insemination system. In this case, we used the same concentration per mil, but half the volume with the PCAI system, and evaluate Ferrin rate and total born compared to conventional AI. So we started off with 50 boars. In this case, we extended to 2.75 billion. One of the things you run into if you want to evaluate in your own system is you may run into a reluctance to go to 2 billion right away. And that's what I ran into here. The producer was not willing to go below the 2.75. So that could be a limitation. Maybe some boars don't express their low fertility unless you go to the low sperm count. But we had to kind of take what we got there. We also decided to put a limit on time because in order to keep track of the groups, and we decided to keep a 3-month limit on time. So however many we can get done, and may have to kick out some boars because we don't have enough matings. And another thing to consider if you do single sire matings is how are you going to control how many matings you get. If there's not a direct link like they have in Netherlands between the boar stud and the sow farm, either you can control it on the sow farm, they keep track of how many matings they do. That's pretty difficult. You can try to keep track of it through the Records Bureau. It does take a lot of time every time you dig through that. We thought an easier way would be to control it by the number of ejaculates sent out. So we had already a collection on the boar, had an idea as historical background as well as what that line typically does, and then determined at the start of the trial how many ejaculates we would need to send out of each boar in order to get our 50 matings. Another important goal for this project was to do PCAI during the heart of the seasonal infertility period. So try to evaluate PCAI at the worst time of fertility, and then we did track daily temperatures from the sow farms as well, so that we could link it back to lactation intake, and also if there was any confounders created by spikes in temperature. So the ejaculates were screened at the stud, just like always. 50 sperm counted in this case. Had to be 70% motility, 70% morphology, 70% most normal acrosomes on their most recent evaluation. And then the testing was done at a reference lab. In this case, it was Chris Custer's lab. And he did a differential morphology with 200 cells, a variety of different motility assessments, sperm plasma membrane viability with the flow cytometry, acrosome integrity, myricyanine, and then we did the sperm chromatin structure assay at South Dakota State Lab. Boars to remove. If a boar had less than 70% in multiple parameters, then we decided he would be removed from the PCAI portion of the study. If he had less than 60% normal on any one parameter, we would remove him. And on the conception rate, we did include gilts in the study as a potential confounder, but kept track of. And we also included recycles. So we didn't just pick, like man does, they just pick day 3 through 6. We included everything. And so we did a conception rate of 80% as a cutoff. So unfortunately, all the sows haven't farrowed in this study. There was a fire at one of the farms, and we had to delay the project a little bit there, and apologize for that. But I'll tell you what we have to date. Boars removed for conception rate and screening. On test results only, there were 2. Well, let's start with the test results and initial conception rate. 3 of the boars, I guess, rang the bell, so to speak, on conception rates and on multiple of those different tests. So they're picked up on like SCSA, Mira test. There were 2 boars who have great conception rates, but were identified on two of the tests as being subfertile. And then the opposite of that is a conception rate only. We had 5 boars who didn't ring the bell on any of the tests, but have below 80% conception. Now with that, in parentheses I have there, 4 of those 5 were right on the border. So maybe our cutoff wasn't at the right spot. So was it the right boars? We looked at halfway through the study, which boars would we pick? This was really a lot of interest to me. If we looked at, like, with half the matings done, which boars would we pick? And then when we finished it up and did the other half and got them all through preg check and they got all the results in and everything corrected, then which boars was it? So the boars that were picked out halfway through, once they got all their matings, because you always got that delay, right? That's one of the challenges. I mean, even if you're just going on conception rate, you got a whole month to wait till you figure out if they're actually bred or not. So you have all these delays you have to wait for. So 5 of the 8 were still below 80%. 3 of the 8 were now above 80%. 2 others were below 80%. And neither of those were identified by any of the tests. Clear? Not so much. Okay, so here's a couple examples. This boar here had 95% conception rate halfway through. He ended up at 72. Another one, and here's the 90% confidence intervals. So obviously he started off good and went bad. Then we had the reverse. Huge variation. Of course, when you start off and only your error bars get narrower because you have more power. The bottom line is you need the numbers. You gotta get a lot of matings done. You can't make conclusions with only a few numbers, or you probably shouldn't be doing it at all, because you can get led astray. This is from a paper back in '93, Will Marsh, and just shows that graphically. When number of observations, if you're only doing, say, 20 or 30 matings, look at the error that you have. I mean, you got to get way out in here before you have any confidence in your decision. And that is a big challenge. You got to commit to doing it right if you're going to do the single sire matings, and make sure you get enough. Another issue you run into is if you don't have really high conception rates, then you need even more numbers, right? Those of you set up statistical studies understand that it's a lot easier to find the difference if they're running in the 90% range. If they're in the 80% range, you need a whole lot more matings. You need to be up around 100 matings probably to have a lot of confidence there. On the total born, about half the sows have farrowed, and we have, at this point, have not identified any additional boars, subfertile boars, than what we identified already. And the farrowing rate, like Amanda showed, we're seeing a very high correlation between conception rate and farrowing rate. Phase 2, so data's still coming on that, and probably more conclusions. Phase 2 is the PCAI portion. And I mentioned already that was to compare conventional at 3 billion to PCAI with basically half of the dose. Had 1,000 sows per group, 2 sow farms, a 2,500 and a 5,000. And the pictures I'm showing you here is, a lot of people ask, how would I implement this type of program? What we did here was did 1 week of training, went out to the farm. The training is quite easy. Those that you have done it, it's pretty simple. But giving them time to practice, we decided up front we'd give them 1 week of practice time before we started in with the regular matings. So here's where we're at with the first half of the matings through conception rate checks, and we are seeing a lower conception rate on the PCAI. So this is the PCAI, 442 sows, conception rate at 81%, and the conventional at 90% at 3 billion. U is sows that are unable to pass the catheter. So that's something, the studies we did back in 2000, that was typically, we'd run like 90, 93% unable to pass. Here we're running, able to pass. In here, only 5 sows out of 447 were unable to pass. So it's like 99% able to pass. So in summary, we do need to be able to reduce the sperm counts. There's too many dollars at stake with the increased genetic value. The PCAI can help us get there. Implementation is not without risk of lower production. What most people I've talked to, there is a typical little bit of a reduction when implemented, and I think maybe not so much the actual PCAI as much as the change in routine for the farm, because it does change how they heat check and when they breed and those types of things. If you want to pre-screen boars, you absolutely have to make sure you breed enough sows per boar. At least 50. If lower farrowing rates, you need higher numbers than that. In my opinion, it'd be a total waste of time to set up a single sire mating program and do like 25 sows. There's just way too much air in there and overlap. You got to commit to doing it right. Wait for the farrowings to properly screen all the boars. We do need the total born information. What do you do in the meantime? Do you use the boar? Do you not use the boar? Do you wait for him? There's a cost in not using him because he's typically going to be a much higher genetic value. But if it turns out to be a boar that had really good conception rate but tanks on the total born, there's a cost there too. So that's something you have to weigh in your own system. The normal morphology and motility screenings on each ejaculate to be used and use that history for culling. I mean, people have been doing that for 15 years. I don't know why you wouldn't do that. It's 20, maybe 30 seconds to count 50 sperm. It's really not a big deal. So that's something you can do today. It's not perfect. You need to be counting 200 or more sperm to get a lot of accuracy, but at least you're doing something. You're going to catch the extreme outliers. And some exciting tests are available. There's the RT testing that PIC has the rights to. Is it worldwide or North America? I can't remember. Worldwide, okay. There's the flow cytometry test. There's more coming, but I feel like we need a lot more development so that we can move forward, maintain or improve the fertility that people have had the luxury of having the last few years, and still be able to go down that and get rid of half the boars or so. So with the lower sperm counts, we need better quality. There's no one test or single sire matings is going to be the solution for a lifetime fertility screen for a boar. I don't think anyone's saying that it is. So we need a combination of tools and probably need some better tools developed, and hopefully we see that in the future and see some investment in those areas.